Assalamu alaikum, Ramzan al-Mubarak. This is Dr. Mohammad Rahman. I am a general dentist and have been practicing on general dentistry 20 years in New York City. I have two offices. One is acute dental care and another one is floral dental care. Today I would like to discuss about a common disease in the mouth, which is gingivitis. Is very common in our community and have a big influence in Ramadan. So before I talk about the disease, let me talk about the healthy gum or gingiva, how it should be. Usually it's a pink soft tissue around the tooth, and it's very good in texture, is smooth and shiny. But when it becomes disease, the first disease is called gingivitis. What is gingivitis? Anything with the itis means inflammation. When you talk about inflammation, we talk about the color. That means, as I said, the gingiva is pink, so it turns to red. And it can be painful, little bit pain. It could be swelling, which is puffy, little bit puffy like soft tissue. And also can be, gum could be receded. That means you can see, like, you can figure out that sometimes you say, oh, my teeth like getting big. It's not getting big, it's like your gum is receding, it's going down or upward. And also the bleeding. When the first sign you can see in gingivitis is the bleeding gums. So when it bleeds, it means the disease just started. So how this disease happen, gingivitis happen? The gingivitis start because we eat a lot of food and drinks. When this food get attached to the tooth surface, it makes like a film, it's called plaque. The plaque consists of bacteria, which really affects the gum. It makes a toxin products and affects the gum. That's how the gingivitis start. So who can get this gingivitis? Anyone. Anyone can get gingivitis, whoever does not take care of their mouth properly. So because we eat food every day, the food, and we have to clean it. If we don't clean properly, that will stay around the tooth and make the plaque and make gingivitis. What are the other factors affecting the gum disease or gingivitis? Smoking is a big factor. If someone smokes, a chain smoker, they are more prone to this disease because of anaerobic condition in the mouth. Also, during pregnancy or puberty, the hormonal changes in our body can also affect, because of the hormonal changes, the gums start bleeding, and then usually patients think, oh, okay, now they don't want to brush properly because they bleed. So that aggravates the disease. Also the alcohol consumption or the drug abuse. Also some autoimmune diseases like the HIV, hepatitis, cancer, all these kind of diseases. Diabetes is a big factor for the gum disease. I don't have too much time on, but that's a big topics to discuss about those diseases. We can discuss in another day about all these diseases. So main thing is oral hygiene. So we have to maintain the oral hygiene before we go to bed every night. That's a common. We have to brush our teeth, we have to floss, which will clean in between teeth, and we have to rinse our mouth. At least 2 times a day we should brush our teeth in the morning in the morning, usually after breakfast. So in the Ramadan time, what we can do after suhoor, after we eat suhoor, we can brush our teeth, we can floss, we can rinse, and then we are good. At the same time, after iftar, or if someone eat dinner also, after dinner we can brush our teeth and then go to bed. The thing is, when we eat dinner and go to sleep without brushing, that's the most dangerous time, because those bacteria really get good time to grow and then cause this problem. So these are the way we have to prevent the gum disease, and definitely we should consult a doctor or dentist every 6 months. That means 2 times a year, get the cleaning to prevent the gum disease. Now, if we leave this gingivitis untreated, then what happens? Then it gets worse. That disease called periodontitis. So there is a membrane in between the gum and the tooth, which usually help to attach the gum to the teeth, because the teeth are not directly attached to the bone, in the jawbone. The teeth, between the teeth and the gum, there is a membrane, and between the bone and the teeth, there is also the periodontal membrane, we call periodontal membrane. That if gingivitis become untreated, the space between the gum and the teeth, it gets bigger, because also the gum gets swollen. So it called pockets. So what pocket does? When there is a pocket, we can put things in the pocket. The same thing. When there is a periodontal pocket in between the gum and the tooth, the food gets in easily and stays there, and the harbors bacteria there, and then eventually it helps to destroy the periodontal membrane, and then it progresses. If it progresses, it can also affect the bone. So when the bone start losing, then is the problem. The tooth start becoming loose, there's some pain start, the swelling and bad breath, bad situations. Sometimes we are embarrassed to talk to the people, and then, so, in Islam, the cleanliness is a part of Iman. So especially in Ramadan time, when we go for long prayer and somebody standing next to us, and we always recite, surahs and all this, and then people cannot tolerate our breath or cannot talk next to us, that's embarrassing. So even, the Islam recommends that before you go to masjid, you clean very well, you stay away from some food like garlic and those, so it don't smell bad. You use some perfumes. So this is very important to keep clean our mouth. So sometimes the bleeding start in the gum, and then after a certain time the bleeding stop. So most of the patients, they think, now I got better. Actually, that's get worse, because before was the acute condition, now is a chronic stage. That means this disease is there and it's going to get worse and worse, but is no longer in acute stage. So that's why there is no bleeding. So it's very important to get the treatment immediately. Sooner you get the treatment, the better the result is. This is the most common cause of losing tooth, is the periodontitis. So if periodontitis happen, what should we do? We cannot treat ourselves. Even it doesn't matter how many times we brush our teeth or floss, it's not going to get better. We have to go to the dentist and get really, sometimes only the cleaning, maybe the solution, and then give some medication to rinse, antimicrobial agents, or sometimes we just get the deep cleaning and then it gets better. But after certain period, as I mentioned before, the pocket, if that pocket depth is more than 5 millimeter, then we need the surgery, the gum surgery. So how we do the gum surgery? We anesthetize that area and we open up the gum like an envelope. We open the envelope like the way we open and close, the same way. We move the gum around the tooth and then we clean, because more than 5 millimeter we cannot clean with those tools we have available regular with the deep cleaning. So we have to open up more and go deeper so we can clean really well. And then sometimes we use some medications. Even if there is a lot of bone loss, we also do bone grafting and then we close. At the same time, patient might need antibiotic. So that's how it can be treated, and then maintenance sometimes every 3 months, even if it's a severe cases, to prevent further damage. So if you get the treatment done, the bone and gum can grow again. So that's a very good way to get rid of the problem we have in the gum. As I said about some predisposing factors, the smoking. In Ramadan time, we don't smoke all day, whoever smoke. So this is a good training. So if we can get rid of smoking, if we can quit smoking, and this Ramadan we can train ourselves so not to smoke, and that's a big decision. Also chewing tobacco or the pan, betel leaf, that also is another major problem, especially in our communities, the Asian subcontinental people, they eat those. So these are the habits we can always control ourselves. If we have other diseases like diabetes, if it's under control, then we can control the bacteria also, because when the blood sugar level is high, the bacteria can grow easily in our body. So, and some medications also affect in the gum diseases. Sometimes our gums swell up. The patient comes with the swelling because they take some blood pressure medications which can do the gingival hyperplasia, which is like the gum gets bigger in around the tooth. Some medication cause dry mouth, especially some cancer patient, and they are under chemotherapy or radiation therapy. So they get dry mouth, so which is called xerostomia. When people have dry mouth, the bacteria also grow easily because we don't wash out easily. When we spit out, basically we are washing out the bacteria very often. So dry mouth is another cause. Now, during pregnancy, it's also very important to take care of our teeth. You should consult the dentist and then get all the treatment done. These gum disease, if we leave untreated, these bacteria can also cause even some heart diseases. So this is very important. This is very related to our whole physical health. So without neglecting is very important. Every 6 months you go to your dentist and get the consultation and get the necessary treatment done. When we talk about periodontitis, we classify in 3 categories. First is the mild periodontitis. When the periodontitis starts in the mild stage, that means is the pocket depth is just little more than 2-3 millimeter, because a normal person can have the pocket depth 2-3 millimeter. That's we consider is as normal. We can just do regular cleaning, and this is not periodontitis. But when it turns to more than 2-3 millimeter, then the mild stage, we can just do the scaling and root planning, and that is done. In moderate cases, we do scaling, root planning, and also some areas we do surgeries, and we can use some antimicrobial agents, antibiotic. Locally, we put around inside the pocket. So that will help to kill the bacteria and decrease the pocket depth. When there is severe cases, that's the most tough area we deal with. When there is severe cases, the teeth start shifting and it gets space in between teeth and start mobility. Patient usually says, "Oh, I feel like this tooth is moving." In severe cases, sometimes it's not only the gum problem. The gum problem leads to the nerve problem. That means it also involves the nerve inside the tooth. In that case, only the gum treatment is not the solution. That we might have to do root canal also because the nerve is involved. So when the nerve is infected inside the tooth, we cannot leave that. We have to treat that. We have to do root canal first, and then we have to do the gum treatment. And most of the time in severe periodontitis cases, patient has to sacrifice a lot of teeth. That means have to take out a lot of teeth in that cases. It's hopeless teeth, and even though patient think that we should keep those teeth, it's very challenging, and maybe it's also very expensive and time consuming to try to save those teeth. So what we do in that kind of cases, usually if we cannot save those teeth, we either remove those teeth and replace. How do we replace? We can make dentures, which is it's very easily done, but it's very discomfort to the patient. Patient doesn't like the denture. This is a removable appliance. So it can be partial denture or complete denture. When there is only few teeth missing, we call partial denture. When all the teeth missing, we call complete dentures. But there is also better solution. We can do bone grafting, taking out tooth bone grafting, and we can place implant, which is more permanent. This is a fixed. Also, there is another thing called is a combination of removable and permanent. That means we put few implants and we make dentures over it. That called implant over denture. This is a very common nowadays. A lot of people they like that because they can also remove those dentures whenever they want. But this denture will not move or come out unless the patient wants it. So these implants really hold the denture in proper place and help eating and talking, the function. So this is very acceptable treatment nowadays. Or someone can have implant which is permanent. All the teeth we can replace by the implant, and make the crown over it or the bridge, implant supported bridge. These are permanent solution, and we don't have to remove. Patient doesn't have to remove those teeth at all. So unless it becomes problem in future or anything. So basically, what we see here, the first thing start as a gingivitis, which is very simple to treat. So if we don't take care at the first place, then we have to go through with all this expensive and time-consuming treatment. So we really have to see, if we see our gum start bleeding, so we don't ignore it. We, as soon as possible, we get the treatments from the professionals. So in future, I'm planning to talk about more on implants and all this with the slide and pictures. So may Allah subhanahu wa ta'ala keep us healthy, and inshallah we'll meet in future.
ITV, Call of Peace, Save Humanity.